go down path. So I will take this time to introduce Dr. Brandon Doucet. Dr. Brandon Doucet completed dental school at Dalhousie University in 2019. After graduating, he worked in rural Newfoundland and currently practices in federal prison. His interests are in surgery and public health. He is the founder of the group Coalition for Dental Care, which seeks to highlight the shortcomings of Canada's dental care system while advocating for a more humane alternative. His forthcoming book with Firma Publishing will be released next spring. So he does have a presentation, and hopefully you'll be able to hear it now. We think we've got the audio working, so I'll ask you to just take it away, Dr. Doucet.
Thank you. Okay, perfect. So we have the presentation up. Yeah, so to start off with, thank you for the introduction. So yes, I'm Brandon Doucet, dentist and founder of the Coalition for Dental Care. And really what I want to talk about today is the importance of oral health, the current state of dental care in Canada, and kind of where we're going, where we should be going, and just some broader trends in this sense. So if we go to the next slide, to start off, really highlighting the importance of oral health so we can better understand the consequences of lack of access to dental care. So this definition from the World Dental Federation shows that clearly oral health is multifaceted, and it's much more than just having the perfect smile. Other international bodies like the World Health Organization have also stated that universal health coverage should be a global priority, and that oral health treatments should be integrated into this coverage. So there's global organizations that are recognizing dental care as healthcare. If we go into the next slide as well, there's many obvious effects of poor oral health, and you're able to hit forward again so the rest of the slide comes up. And I think one more time. Perfect. So while there's many obvious effects of poor oral health, like, a toothache can impact your sleep, having missing front teeth can affect your self-esteem, employability, and things like that. But there's also many other effects of poor oral health that can extend beyond the more immediate social impacts and actually affect many general health conditions. As you can see, some of them listed here, but for many years, the research has shown that poor oral health has been associated with poor general health. But research has been increasingly showing that poor oral health, it's not just associated with poor general health, but it can actually cause it. So if we go on to the next slide here, it shows that there's many general health conditions that are not just, it's not just correlated, but it's actually causative. So research has shown a bidirectional relationship between type 2 diabetes and periodontal disease. So treating periodontal disease in type 2 diabetics has been shown to improve blood sugar control, similar to adding another medication. In controlling blood sugar in type 2 diabetics has been shown to reduce the progression of periodontal disease. Providing routine care, oral care to residents in long-term care settings has been shown to reduce patients' risk for aspiration pneumonia because they're less likely to inhale the bacteria in the plaque buildup on their teeth, leading to a lung infection. So also treating periodontal disease has been shown to reduce patients' risk for cardiovascular disease. And many of these are because periodontal disease results in chronic inflammation that can affect these other general health conditions. Research has also shown that providing oral health care to people struggling with drug addiction led to a greater likelihood of completing treatment, increased employment, decreased relapses, and reduced homelessness. So clearly, lack of access to dental care contributes considerably to the cycle of poverty. First, when someone doesn't have dental insurance or sufficient disposable income, they lack sufficient access to dental care, and many experience poor oral health. When poor oral health can affect employability, it further perpetuates the cycle of poverty. We can imagine the preconceived notions an employer might make when an individual is approaching a job interview with visible dental decay or missing front teeth. Also, dental pain can impact someone's performance at work. It can be challenging to concentrate on tasks when you're experiencing excruciating dental pain, especially if that pain's kept you up at night as well. in the time someone lacks access to dental care, things fester and they get worse, and it only becomes more expensive for people to treat and address. So if we go on to the next slide here, we can see that, dental infections as well, they're localized infections, but they can actually spread and overwhelm the body and lead to other serious health conditions. You say an infection of an upper tooth can spread to the brain. An infection of a lower tooth can cause swelling that can compress the airway. And if we go on to the next slide, we'll see this actually pops up in the news from time to time. And I'm sure there's many times in which these fly under the radar of people having, life-threatening infections that were caused from a dental infection. And this is, I think, a good segue to talk about Canada's dental care system and some of the inefficiencies that it causes within our healthcare system. And I like using the story of the gentleman here on the right who was highlighted in a CBC News article about 5 or 6 months ago, and his name's Shane McKenzie. And he had a dental infection that led to him being placed in a medically induced coma for 10 days. He was in an intensive care unit for a month and a half and in long-term care setting for over a year. In this time, he needed dialysis for his kidneys. He lost his right leg below his knees, the toes on his left foot, and the fingers on his left hand and a few fingers on his right hand. All this pain and suffering, along with tremendous use of healthcare resources, all because of a dental infection that could have been prevented with upstream investments in public dental care. So now that we've kind of established, I think it's pretty obvious dental care is healthcare, and therefore we should ensure people have access to dental care. In the rest of the presentation, I hope to show how Canada's current dental care system is inconsistent with the Canada Health Act's mission to, quote, protect, promote, and restore the physical and mental well-being of residents of Canada and to facilitate reasonable access to health services without financial or other barriers. And also looking at how we can create a dental care system that does guarantee access to dental care and, politically speaking, can actually stand the test of time. So if we go on to the next slide, we can see that dental care in Canada is overwhelmingly privatized, with 94% of payments coming from private sources like work-related insurance or out-of-pocket payments, and only a meager 6% comes from targeted government programs. Canada's share of public dental spending is so low that it ranks second last amongst OECD countries, with Canada doing even worse than the Americans. This is a very low bar. When we have very little public dental spending as well, we see greater inequalities in access to care, and there tends to be people with low dental needs tend to have an easier time accessing dental care than people with high dental needs. So a very dysfunctional way of structuring a healthcare system. So if we go into the next slide, I just have a couple of graphs from the recent environmental scan of publicly financed dental care in Canada, and it just shows you how much. So the orange line here is private dental spending, which we've seen go up very significantly over the years, but public dental spending is very much flatlined. If we go on to the next slide, and it actually zooms in a little more on just the public dental spending aspect, what we see on the next slide is that there actually was some improvements in increasing public dental spending around the 1980s when we saw the rise of some, fairly robust children's dental programs. They weren't perfect, and we'll go into some examples, especially of the one that was in Saskatchewan later on, of the successes of these programs. But there was some increases in public dental programs, but we've seen that tapering off and actually decreasing over time. And that's something we'll end up talking about later in the talk as well, about the politics as to why this happens. If we go to the next slide as well, this is just a graph I like to show. It shows public dental spending among OECD countries. We can see Canada's way at the bottom. And really, when we're talking about comparing ourselves to other developed countries, we're really an outlier in how badly we do in this sense. So on the next slide, it's just kind of a funny, we do even worse than the Americans. So if we, one more time, We can see, public dental spending in Canada, even lower than the Americans. Very low bar. We like to compare ourselves and always act smug that we're better than the Americans, but I think we need to have some humility when it comes to access to dental care because we're really not doing well. So if we go to the next slide, we can see some of the consequences of having an overly privatized dental care system. And really what it boils down to is that those with high dental needs are less likely to seek dental services than those with low dental needs. People with low dental needs, on average, people who come from more well-off backgrounds have good insurance, whereas people who have high dental needs are less likely to have dental insurance and also less likely to have the means to pay for dental care out of pocket. I do like to point out that 1 in 3 people lacking dental insurance does not mean 2/3 have access to dental care, which is a narrative pushed by the Canadian Dental Association. It's important for us to push back on this. There are many people with insurance who still struggle to access dental care because of the co-payments, the yearly limits, the lack of services covered, and even finding a dentist who will accept them for those relying on the meager targeted government programs. With that being said, access to dental care and access to dental insurance does fundamentally change the way people access care, because when you have to pay fully out of pocket, it forces a lot of people to seek care only for emergency services rather than preventative services and early interventions. So when people neglect their dental problems, it festers, it gets worse, and it leads to worse oral health outcomes and added spending. And fortunately, too, these problems have actually been getting worse. So if we go on to the next slide, we can see that fewer employers have been providing benefits like work-related insurance tied to people's labor. So we've seen the number of uninsured people increasing. This is largely due to a decrease in unionization rates, so people aren't able to as effectively negotiate benefits like dental insurance. We're also seeing the rise of the precarious gig economy, which does not provide many benefits, doesn't provide benefits tied to labor. And we're also seeing a lot of older people retiring and losing their work-related benefits. And we're also going through a tremendous financial downturn, like the COVID-19 pandemic, but these things happen periodically, like the 2008 financial crisis as well. And this causes people to lose employment, which means they lose their work-related dental insurance, and they also lose disposable income to pay for these services out of pocket. So people are struggling to access dental care. We're going through, like, things have been actively getting worse. So on to the next slide, we can see some of the consequences of this, like people going to the emergency department for dental pain. And really, the emergency department is the ultimate low barrier social safety net. People go to the emergency department for dental pain because there's an upstream public policy failure in investing in public dental care and ensuring people can go to the dentist. But when you have a raging toothache and you have nowhere else to turn because you can't afford to go to the dentist, you go to the emergency department where people end up getting prescriptions for pain medications and for infection, which has their own complications. Like, toothaches are so severe that often people are required to receive an opiate, which, as we know, has complications and downsides towards using, and also antibiotics, which when we rely on antibiotics, the more we use them, the more likely we are to see antibiotic resistant strains and kind of superbugs develop that can dodge these antibiotics. So we shouldn't be relying on antibiotics in lieu of actually providing people access to dental care, because a lot of these people, they get these medications in the emergency department and then they can't afford the subsequent follow-up to go to the dentist. So these things flare up again down the road. Very inefficient way of doing things. If we go on to the next slide, we can see that because so many children lack access to dental care, dental decay festers to the point where they can't be treated in an outpatient setting and they require general anesthesia to be treated. This is a very traumatic thing for children, and it also strains an already overwhelmed healthcare system. And there's other factors that compound into this, like rural geography and poverty are two factors that just make things even worse. because in rural settings, there tends to be an inadequate dental workforce already to meet the population needs, and poverty is another factor in this as well. So we see things getting even worse. This, along with other factors like the high cost of food, lack of clean water infrastructure, and housing insecurities, are really big reasons why many Indigenous communities struggle with oral health. If we go on to the next slide here, I think this is a good point for us to start our discussion, talk about the elephant in the room. So I'm sure we've all heard about the federal NDP dental plan that has been, there's talks about it coming to fruition over the next couple of years. And while this would be the single largest investment in oral health in Canadian history, the program would have some shortcomings. And I think we need to ask ourselves, is getting this dental plan our end goal? Or is it do we see it as a stepping stone to something greater? And, I hope I can highlight that. I think we do need to get to something greater. So if we go on to the next slide, and then the one after that, we can see, I think you can hit it one more time. We can see the NDP dental plan will integrate dental care into our healthcare system a little more. We go from about 5% of dental spending being public to about 15 or 20%. So that is a big step in the right direction. It would help many people, but there are still shortcomings. So if we go to the next slide, I think you can go one more time, perfect. So, if we're comparing ourselves to other countries, okay, now we're doing a little better than the Americans, but from an international context, we're still way behind a country like, say, Japan, where public dental spending is about 3/4 of dental spending. If we look at a country like Germany, over half of dental spending comes from public sources, and we're still well below the OECD average, where public dental spending among OECD countries averages about 31.5%. So because our starting point is so bad, this sizable investment will still leave us with a lot of inequalities in access to dental care. And it also will still rely heavily on private insurance and private practices to deliver care, which has shortcomings that we're going to discuss soon. So if we go on to the next slide, we can see that, the NDP dental plan will undoubtedly be a step in the right direction. It would be the largest investment in oral health in Canadian history. I don't want to downplay that, but there are shortcomings, and I strongly believe we need to go to something greater. And the three principles of this that I would like to talk about are from what we at the Coalition for Dental Care call universal dental care. So this is something we came up through many discussions. My points of contention really come from where we need to be. We need to have a vision of what we want as our end goal. I understand that some of the things may be lofty, but even ideas like universal health care at one point were viewed as unreasonable or unattainable. So there's really, what is attainable is subject to change, and really it's dependent on what people like you and I do about it. We do have the ability to impact these things. So if we go to the next slide, and then I think the one after, I'll kind of talk about each one of those three categories here. So the first one is universal dental insurance. So I think you can go ahead a slide or two, please. And I think you can go, perfect. So universal dental insurance, the idea of this is taking the funding for dental care out of the private profit-seeking sector and placing it in the public sector. Essentially, this would mean dental care is included in Canada's universal healthcare system, because the way our healthcare system works, it's public financing of private clinics. This has benefits and shortcomings, but just to highlight some of the benefits of it, it guarantees that there will be no gaps in coverage. And it also removes the discrimination that people face when they rely on public programs, where the people relying on the public program struggle to find a dentist who will accept them. The stability, so people don't have to worry about losing coverage when they retire, they become unemployed, and even people who rely on their significant others' work-related insurance, and then the relationship ends, people will lose their coverage then. Guaranteeing dental insurance for all would reverse what's known as the inverse care law. So people who have high dental needs would be more likely to seek dental care than those with low dental needs. it's a very common sense way that we should be structuring a healthcare system. It's also more efficient to group everyone together under one program, as the administrative aspects can be streamlined through a single program. It's much more efficient to do this way. And also the risk pool would be better. So the way insurance looks at things, like if the way the NDP dental plan would be structured, on average, low income people have higher dental needs. So that's a higher risk pool. Whereas if we grouped everyone under an single insurance plan, the average risk, so the average amount someone's going to have to use the plan is lower. With the NDP dental plan, the populations that are on average lower risk will be left to the private insurance industry to profit off of. But I think we should use those resources directly for dental care. All of these benefits could lead to more people accessing routine dental care rather than just emergency procedures. Also, the politics of universal programs matter, because with targeted dental programs, the public spending is viewed more as welfare, which is unpopular and easy to undermine. Targeted programs create tension between those that are eligible for publicly funded dental care and those who are not and have to pay for care out of pocket. On the other hand, universal programs create a collective pride amongst the society that makes people view public spending as healthcare, which is more popular and harder to undermine. This political failure of targeted programs is why public dental spending in Canada is so low today. In the 1980s, public dental spending actually accounted for 20% of overall dental spending, as I mentioned, but over time, these targeted programs were undermined and underfunded without broad pushback from the population because the cutbacks only affected poor, marginalized communities. This has led to programs for children becoming programs for low-income children, fewer procedures being covered, and the fees these programs pay out being de-indexed from inflation, meaning people who rely on those programs often struggle to find a dentist who will accept them. If we go to the next slide here, there's a quote that I really like from some researchers highlighting the shortcomings of targeted dental programs, or targeted programs in general, why they're politically weak and why they don't stand the test of time as reliably as universal social programs. Since everyone relies on universal programs, underfunding is seen as an attack on the society as a whole, and it receives much broader backlash to the point where it's less politically feasible to do so. This is why funding for Medicare has kept pace with inflation over the decades. You know, there's problems, but it has kept pace with inflation, while public dental spending has actually decreased. So even if the NDP dental plan starts off strong and provides pretty decent coverage for the population, the targeted nature of the program could lead the programs to being eroded over time, like the existing targeted dental programs have. This is why I strongly believe we need to move towards a truly universal dental system in the long run. This could be a stepping stone towards that, as the NDP MP and health critic for the NDP, Don Davies, has stated, but it's really dependent on how much momentum we can build around this issue in the meantime. Even as I like to point out, 3 years ago when I founded the Coalition for Dental Care group, the idea of even the NDP dental plan was, by many in the dental community, was viewed as kind of pie in the sky, unreasonable and unachievable. But we're in a very different place now. And it really does depend on what people like you and I do about it. If we create momentum around this issue, there is the potential for change. And I think this, this minority parliament where we're going through right now is a once in a generation opportunity to improve millions of people's lives. If we go on to the next slide here, so while Canada's dental care system, we need to shift towards public financing of dental insurance for all. It's only one piece of the puzzle in ensuring access to dental care. The other key component is changing the delivery of dental care. With universal dental insurance, it's dental care is free at the point of access, but there's no effort made to ensure people have access to a dental provider to do the work. This makes insurance-based programs more likely to react to dental disease once it occurs, rather than a system that seeks to guarantee access to a dental provider. which can guarantee, it places a greater focus on prevention and early intervention rather than reacting to disease once it occurs. I'm excited to talk here today with members of the Saskatchewan Oral Health Coalition because these other two pillars, the public ownership of dental clinics and use of dental therapists, is a really exciting part that I like to talk about our universal dental care plan, because Saskatchewan was actually a leader in this in the 1970s and 80s. I'm sure many of you are aware of this. If we want to go to the next slide, we can see, so public ownership. So with private practice model, clinics are set up where people can make the most money rather than where the greatest dental needs are. This is becoming increasingly a problem with the growth of dental corporations that, you know, there's corporate entities that own hundreds of dental practices that are just using this as an investment vehicle, increasing the commercialization of dental care and taking dental care further away from what I view as healthcare. This has meant that a disproportionate number of dentists have set up clinics in wealthier urban areas where dentists can focus on luxury and cosmetic services, leaving poor and rural communities underserviced. Public delivery model seeks to distribute the dental workforce based on public health needs rather than profitability. This effort seeks to ensure people not only have access to dental insurance, but also a provider. Private practices also, they're not always easy to access as people need to take time off of work, drive to clinics, and these private practices may not be accessible to everyone once they're there. Whereas public delivery, you can bring dental providers to people. Let's say, for example, in long-term care facilities. This is much easier than trying to get each resident out to the nearest dental clinic. This makes sure that our society's most vulnerable don't fall through the cracks, and that these populations with high dental needs are able to access preventative services and early intervention rather than just emergency services. So while I believe public ownership of dental clinic allows us to fundamentally change these priorities, currently our dental care system prioritizes the Hollywood smile makeover over a child that needs dental surgery in a hospital. While the targeted federal NDP dental plan will shift these priorities a little bit in the more humane direction, ultimately, I believe there's still a lot more work that needs to be done, especially considering the system would still be dominated by private health insurance and private delivery. Public delivery allows us to fundamentally shift these priorities in a way that private delivery never could. Private practice and private delivery needs to focus on profits. There's no other option. We go to the next slide. Dental therapy. So public delivery also allows us to bring dental therapy into the mainstream in Canada. For anyone who's not familiar, an analogy I like to use is dental therapists are to dentists as to what nurse practitioners are to physicians. The difference is with dentistry, there's a lot of the care that is fairly routine, and the use of these dental therapists allows us to increase the dental workforce in a cost-efficient way to meet the population needs much more than if we just relied on dentists. Dental therapy meshes well with the public delivery model because it's much more cost-effective. And I think this is something that when we communicate this message to the public, they get really excited about it, because the biggest opposition or concern I hear from people talking about a universal dental care system is how expensive it is going to the dentist. And I think when we talk about dental therapy and the public delivery model, it clicks for people that like, wow, we could do this in so much more of an efficient way. And they get excited about it. So I think, you know, if we could take much of this routine work and have dental therapists do more and more of it, it would result in cost savings that would allow a universal dental care system. So like the tax dollars that go to it go much further. And dentists, especially in these communities where there's an inadequate supply of dental workforce to meet the population needs, say, the dental therapist could be doing the checkups, cleanings, fillings and stuff like that. So when a dentist is there, they can focus on procedures like root canals or something like that when they're there. It's a much more efficient way of doing things. So if we go on to the next slide, this is something I like to talk about is the Saskatchewan Dental Plan. So as I'm sure many of you are aware of, Saskatchewan has been a leader in North America in public delivery, the dental therapy model. In the 1970s and 80s, the provincial NDP government brought in school-based dental clinics where much of the routine work was done by dental therapists. It was highly successful at its peak. It treated around 90% of school-age children, and it was very cost-effective in doing so. So if we go on to the next slide, though, we can see, this is from an economist writing this, that the success of the Saskatchewan dental program was because it changed the delivery model from private practice dentists working on a fee-for-service basis to publicly funded and owned school-based clinics with salaried dental therapists. This was the reason for the success. Over the first 6 years of the program, children enrolled needed on average 50% fewer extractions because of the emphasis on prevention and the easy accessibility of the services. A double-blind study found that dental therapists in the Saskatchewan Dental Plan did work of equal or higher quality than dentists. Now, this program ended up being privatized by subsequent Conservative government in Saskatchewan in the mid to late 1980s, not because the program was failing, but because the program was succeeding, which made dentists in private practice mad because they saw this alternative dental delivery model as a threat to their monopoly on care and the system that allowed dentists to profit off of other people's labor. This is why the section of my book that will be coming out with Fernwood next spring, the section that focuses on this Saskatchewan Dental Plan and dental therapy, it's called The Threat of a Good Example. I think the fact that organized dentistry felt so insecure about this model is telling and a weakness that should be exploited. Because even organized dentistry is aware of how successful the dental therapy public delivery model is. So while most Canadians are unaware of this model, I think if we could start to bring this model into the mainstream, I think Canadians would get excited about it and support it very strongly. Because who wouldn't want to increase access to dental care in the most cost-efficient way possible? I think people are really beginning to recognize more and more that dental care is primary health care, and the profit motive really doesn't have a place in this industry. These publicly owned dental clinics with dental therapists, but also the rest of the dental team as well. So dental hygienists, assistants, denturists, and dentists, they can all work in these settings, say like schools, long-term care facilities, community and indigenous health centers, prisons, homeless shelters, and many other locations. But there's a long way away from making this a reality, and I do think we need to create some momentum around this. I am happy to see the new dental therapy training program that will be opening up in Saskatchewan. It is a small scale, and after over a decade of there being no dental therapy training programs in this country, we do need to find ways of leveraging the successes of this new program as well as previous programs to bring dental therapy in the mainstream. In my mind, we need to, at a bare minimum, be graduating as many dental therapists as we are dentists. If we go on to the next slide here, I think I like this slide of just highlighting some of the pros and cons of the NDP dental plan. I do think this is going to eat up a lot of the discussion over the next several years on dental care. So it will rapidly fill gaps in coverage of uninsured populations. It's very tangible and will help many people. It will triple public dental spending. Those are very much good things. There is problems with targeted programs because people relying on them, they tend to be discriminated against in comparison to people who rely on private plans because the programs pay out lower fees than private plans. Now, I think the program might start off fairly strong in comparison to other public dental programs, but my concern is over time they could be eroded like the existing public dental programs are if we don't use this as kind of a launching point to something greater. It does rely on private delivery. As I've said, there are shortcomings of this. Now, as far as the feasibility of things in the short term, private delivery is all we have, and building that infrastructure to have the public delivery model does take some time. So, you know, it's kind of we need to deal with things where they're at, but I do think we need to be putting a strong effort to actually be building that public dental infrastructure so that, you know, access to dental care in a generation from now could look very different than it does now. With the NDP dental plan, we'll also still be relying on insurance, like the private insurance industry. People are still going to have, you know, high co-payments. There's still going to be limits on the insurance, whether it be the NDP dental plan or private insurance. Like, people have yearly limits. Well, as many of you are aware of, you know, our dental needs and our health needs don't respect these yearly limits that are based on insurance plans. And this is really just a cost savings mechanism, whether it be for governments administering these programs or private insurance. And I think we need to be moving towards guaranteeing access to dental care as a right. So that means no co-payments, no yearly limits, anything like that. Yeah, so that really, if we go to the next slide, it really brings my discussion here to an end. I want to thank you for inviting me here today. I do recommend anyone who's interested in helping with the work that we do at the Coalition for Dental Care to reach out to us, either through our email or through one of our social media pages. Yeah, I think it's a very exciting time for dental care in Canada. I think we really need to maximize the amount of progress we can make.
So thank you, Dr. Doucet. I can't see you anymore. Can you bring it back, Lena, for a minute? I'm glad that the sound worked out. That was good.
Yeah.
Can you see us, Lena, or not? Okay.
He can see you.
Okay. So thank you very much, Dr. Doucet. I like your vision. I like your dream. I am a Saskatchewan dental therapist. I was in the first class of dental therapists that graduated and implemented the dental plan, and you're bang on all your points. And actually, I have a presentation following yours, so I'm going to do a reflection on the dental plan. So anyways, thank you very much. If you could please give your mailing address to Lena, our thanks are on the way. Okay, thank you very much.
Thank you for having me.